My Doctor, your health anytime, anywhere.
Hello, lovely people. Welcome to the My Doctor podcast, where our aim is to bridge the gap between our doctors, our health workers, and the community. So we normally have conversations, meaningful conversations about different health aspects, clearing out different misconceptions. Basically, we want you to be able to know your body, what you can do to maintain it, maintain health. If you're going through any sickness or health problem, what can you do to cope? Yeah. So we have been having various episodes. You can just search My Doctor. If you want to know, we have had an episode on adolescent health. We have had an episode on NCDs, non-communicable diseases like diabetes. We have had an episode on UTIs and STDs. Yeah, so there are very many episodes. So if you're interested in those topics, please, you could search and then you will find all that information. So for today, we have another interesting topic. And this is to our pregnant mummies and anyone who's around a pregnant mother. So our topic today is morning sickness versus Hyperemesis Gravidarum. And we're going to find out what those are. And today I am with a very, very good doctor. He's called Dr. Blair. I'm going to give him a chance to introduce himself. Yes, you're welcome, Dr. Blair.
Thank you so much, Joy.
How are you?
I'm doing well. How are you?
I'm fine. Could you tell our viewers who you are?
Yeah.
In summary.
So my name is Dr. Blair Kizza. I'm a medical doctor by profession. I'm an MRI researcher. I do lots of volunteer work. So I happen to have an NGO called Usawa Health Initiative Uganda, which I serve as the founder and executive director. With regards to research, I've done lots of research with regards to sexual and reproductive health. And my key highlight research is the research I did on Hyperemesis Gravidarum, which I'll be presenting the findings in the US at the annual colloquium of Hyperemesis Gravidarum come November. So today it's a very beautiful moment for me to share what I know because it's a very sensitive topic. It's overlooked, but if you get the right information, you can actually be helped.
Okay, so before we dig into the Hyperemesis Gravidarum, I want us to start with morning sickness, yeah? So could you help explain to our viewers what is morning sickness and what are the normal signs and symptoms, really?
So morning sickness is, it's a layman term that simply means having that nausea. Sometimes it can progress to you vomiting or throwing up. So basically the hallmark of morning sickness is nausea plus or minus vomiting. And the way it sounds like morning sickness, most people may tend to think that it actually happens only in the morning. So it's not that like that. It can happen any day, anytime. Though higher levels, most times it tends to be worse in the morning. Yes, so it happens around the 4th to 16th week in pregnancy. That's around the first month, shortly after the first month when it's about to end, and around the 4th month. Usually that's the peak time of someone getting morning sickness. So back then, actually, in our traditional society, that's what our aunties used to notice to tell that she's pregnant or not, because they would just watch you in the morning as you try to go either make some breakfast for the people in the family, and then the moment you bend over, most girls will run off to go and throw up. So hence the name morning sickness. Yes, in a nutshell, that's how I would put it.
So in other words, it's normal in pregnancy.
It is very much normal because you find that 70 to 80% of all pregnant women in the whole world experience it. And it's mostly nausea. So 70 to 80% will experience nausea. And then studies have shown that only 50% of that big percentage that I've mentioned progress to vomiting. So it doesn't necessarily mean that every pregnant woman should experience nausea and progress to throwing up, as it used to be used as the sign. So you can be pregnant and you don't get any nausea and you don't even throw up. But back then, as it used to be used as a sign to tell if someone is pregnant or not. But now we have tests. You don't necessarily have to watch yourself get nauseated or throwing up to know that you're pregnant or not. Yeah.
So are there some things these ladies can do to cope with the nausea or prevent it or?
Yeah. So that's a very beautiful question. You find that it's important to understand what really brings that nausea and vomiting sometimes. Usually, the short answer to that is hormones. Because when you're pregnant, lots of changes are going on in your body. Your body is trying to adjust to you having something else that you're carrying in your body. Your menstrual cycle is trying to adjust now that you're not having any more periods. It produces some hormones that are relevant to sustaining your pregnancy. So there's a very important hormone called human chorionic gonadotropin, or in short form, it's called HCG. So for those of you who have done pregnancy tests, you know what HCG is. So when you're doing a pregnancy test, you're actually looking for that hormone. Usually appears in urine as well. So it means that if you're pregnant, you're going to have that hormone in your blood. So that hormone has been studied, and it shows that it causes the vomiting centers. You have a part in your brain that is responsible for you being nauseated or vomiting. It's called the vomiting center. So that hormone has been shown that it heightens your nausea and vomiting. So as long as you're pregnant, your brain is really sensitive to vomiting. So that's why you find that most people are throwing up, that they are pregnant. So once you understand that, then it's easy for you to try to know how to manage it. So first, you need to embrace it. You need to know that I'm pregnant and nausea is a thing that will come along with the pregnancy. So knowing that, it means you won't try out medicine for ulcers, because most people tend to think that it's my ulcers that are causing me to be nauseated and throwing up. So it means you won't walk from pharmacy to pharmacy getting those funny drugs to try and lower down your nausea and vomiting. So once you understand that it's due to the hormones, and there's nothing I'm going to do to fight the hormones, I just have to embrace it. So your simple things will help out. So things like eating small and frequent meals, not having a very huge chunk of food. You're having, let me say how streetwise, 3 KFC, you're having Javas. So you need to pace yourself, small amounts of food at a given time. So that helps your stomach to try and process small foods at a time so that you don't fill up your stomach to the point that you throw up. Then you can use ginger. Ginger has anti-nausea properties. So if you get some ginger, put in some warm water, you take small sips, pace yourself. It will help out. Then also, another important aspect is that once you're pregnant, you're very sensitive. So sensitivity also cuts across through the smell, hearing. You've seen pregnant women who, if they hear a car honking, they get nauseated and throw up. We've seen pregnant women, if someone smokes in their presence, they want to throw up. So trying to understand the things you're sensitive to, and you try to stay away from them as much as possible.
Okay. So before we leave the morning sickness, are there some foods that are known to trigger the nausea in all women, or every woman is different and they should maybe try to identify what gets them nauseated?
Yeah. So that's very beautiful. To answer that is it varies country to country, region to region. When you look at Uganda, we don't eat a lot of spiced food. Spiced food is not our thing. So if you're pregnant, or even if you're not pregnant, and you try out something like spiced food, you may throw up because your stomach is not like really built to that state. You've not been used to that. So if you try out something new, especially overly fried, spicy foods, they'll make you throw up. So this goes to women in Uganda. But if you look at people in the West Africa, you look at Asian countries like India, they eat a lot of spiced food. So for them, it's okay. So you can't tell them to do away with spicy food that they will throw up because that's something they're used to. It's all about understanding the region. But in Uganda, usually spicy food, overly fried foods, those are things that really make women get nauseated and throw up. Yeah.
So in Uganda, some ladies, when they experience the nausea and vomiting, they tend to resort to clay. What do you say about that? Is that okay? Is it okay for the baby, for their body?
Yeah. So that is a yes and no answer to it, because clay, as in Luganda they call it a mumbwa. So usually it's sold by local people. There are people who go in those birombe in the I don't know, in the clay areas, and they collect that clay and then they mold it and then they pack it and then they sell to pregnant women. Now, the problem with that is, one, we're not sure of how exactly it's prepared. Are the places clean? I'm worried about contamination, me as a doctor. So I'm looking at a lot of things that can go wrong when you're preparing it. But on the other hand, clay, medically, it's a very good option because it minimizes absorption in the stomach, especially when someone has had a toxin, or maybe they have eaten something that is presumed to be toxic, and then you take clay. The way you sip charcoal, clay does the same purpose. Also, in the same limelight, clay reduces the stomach acid. So for people who have ulcers, people who have hyperacidity, and you take clay is very important because it lowers the acid. At the same time, it kind of absorbs the toxin in the lining of the stomach and then the intestines going down. So it can be a very good option for nausea and vomiting. That's very true. But then on the other side, the preparation of it, it's a bit problematic. And also, as I mentioned, that it affects absorption generally. So it means if you eat food and then you've like been taking your clay, you may not benefit from the food that you've eaten because there will be barely anything absorbed in the stomach. So you find people, they're eating food, but then they're not benefiting from that food because they're big on clay. Yeah? So I would say just take it with a pinch of salt.
I would also want us to tell the pregnant ladies out there what they could eat that is good for their bodies and the babies. Like, what things are nutritious for them? What could they eat?
Okay,
be intentional about having a good time.
Yeah, definitely. That's a very good question. So nauseated or not, there are some foods that are very important in pregnancy. So one, it includes a lot of vegetables and fruits, because the reason why we recommend vegetables and fruits is because we want you to benefit from lots of vitamins, especially an important one called folate. So in early pregnancy, less than 3 months, you should be very big on fruits and vegetables. But definitely, given that there is another human being growing inside you, and for anything to grow, you need proteins. So you need to have, again, it's a combination of foods. You need to have proteins in your body. So things like beef, things like mutton, things like chicken, things like pork for those who eat pork, and things like beans. So anything that has proteins in it is okay. Then also you need the energy to go through the day. And for energy, you need fats and carbohydrates. So things to do with rice or mchele, things to do with sweet potatoes, things to do with yams, things to do with cassava. It's a whole big list. But what I'm trying to drive at is you need a balanced diet. I've seen pregnant women who, once they get pregnant, they're eating one thing. They say, for me, I only want to eat cassava. And they eat cassava without sauce. They be like, me, I want to eat cassava. That's it for me. So that will have implications on your body, because you will drive into a state where the baby that is growing inside you needs proteins, and you can't tell the baby anything. So what will happen is that your body will break down the muscles on your body to get proteins from the muscles to supply the baby that is growing inside you, because there's no excuse. That's why you find people get pregnant and they lose a lot of weight because they're not eating the right foodstuffs. In that instance, they're not eating enough protein. So the body is breaking down the muscles on their body to supply the baby that is growing inside. And also you find that it also has implications on the baby, because whatever they break down from the muscles will never be enough for the baby, because your body has to utilize some, and at the same time, the baby has to take some. So you find that you give birth to a baby who is underweight, a baby who has already impact in one way or the other. So you need to know that you need to eat more than you've been eating, because now your body has to use some. Also, the baby has to take some. So whenever you're eating, have this thing in your mind that I'm eating for two.
Eating for two.
Yeah.
So about the fruits, yeah? Could you highlight for us are there specific fruits or any fruit?
So basically any fruit is okay, but preferably fruits that have the nutrients that we are much more interested in include mangoes, pineapples, include oranges, but then oranges have a bit of acid in them. So if you're a person that has ulcers or you're struggling with nausea and vomiting, you should try to minimize the amount of lemon, the amount of oranges that you take. But if you can really go on mango, apples, watermelon, pumpkin, and all that, they're actually very good sources of the nutrients we're interested in.
Okay. So there's this myth that I've heard on TikTok where pregnant ladies believe that they shouldn't eat fruits because they increase their blood levels beyond normal. I've never heard of that. Do you think is that something people are just saying?
Yeah, that's the thing. So when you're pregnant, again, as I mentioned at the start of the conversation, that we have changes in our body. So one of the changes that we get is the blood of a pregnant woman is diluted because our body tends to retain a lot of water. So you as a person, you can never know. But us as doctors, we know that your blood will get a bit diluted. So if we do some tests, especially if we do a test called CBC, there are things we expect to see in a pregnant woman. So as a layperson, you can't tell that your blood has changed in this way or not. So whether you drink a lot of water, whether you don't drink a lot of water, whether you're stepping away from the whole fruit eating, these changes will occur. So fruits do not directly or in any way affect your blood levels. They do not. I have to dispel that. Just go ahead and eat your fruits. Yeah.
So I think the ladies out there have really understood morning sickness and they know how to go about it. So now I want us to dive into the Hyperemesis Gravidarum. So could you tell us what it is and at what point does someone know that they have crossed from the normal morning sickness to Hyperemesis Gravidarum?
Okay, so Hyperemesis Gravidarum, it's a very hard term. It's a technical term. Even spelling it, you get a headache. You get a headache by just mentioning it. But hyperemesis, to start with, it's a word that is a combination of actually two words. So we have the word hyper and we have another one called emesis. So hyper simply means something that is extra, something that is beyond, something that has increased. And then the word emesis, it's a Latin word that stands for vomiting. So it means if you combine the two, you'll get what we call extreme vomiting or abnormal vomiting. And then gravidarum, it's another Latin word that simply means pregnancy. So it means it's that extreme vomiting that occurs in pregnancy. So as we've been having this conversation of morning sickness, nausea, some even proceed to vomit, it's been something that has been on the lower end. It's something that is tolerable, it's something that is manageable. But if it goes out of hand and you're vomiting more than 3-4 times in a day, with or without food, for you, you're continuously throwing up, you've lost weight. Because it's always important to know your weight before you actually get pregnant. And it's also important to know that your weight has to increase when you're pregnant, slightly. If it happens a time when you're pregnant and the weight that you have at the point when you're pregnant is less than the weight you had before you got pregnant, that's when you know that I've actually lost weight. So if you combine the extreme vomiting and that loss of weight where you weigh less than what you used to weigh before you got pregnant, yet you're having something that is growing inside you that is supposed to add you extra weight, then it means you've lost weight from whatever is happening to your body. So it's that excessive vomiting that disables you, that makes you lose weight at the same time and takes an emotional toll on you as a person. So it's not an easy thing. Just imagine where you're barely eating anything. First of all, you're having this whole stress of being pregnant. But being pregnant is never easy. It's not an easy state. Never an easy state. And on top of that emotional toll you're having on pregnancy, especially Black women getting pregnant, Africans, the Ugandan men can change their mind anytime. Most women actually are pregnant and then they're not sure who the father is, or the father said, for us, we don't. We don't give birth. So you find that you're having all this stress, the economy, the roads in Uganda, all that stress. And then you add this stress of you being excessively throwing up from morning to evening, you being unable to eat or eat and tolerate anything. So that's what we define as hyperemesis gravidarum. Yeah.
Okay. Are there any known causes?
So, yeah, we have some established causes, but at the same time, we have unknown causes. So largely the cause is unknown. There is, we do not understand why certain women extremely vomit, go in that state where they're extremely vomiting. But we have a few established causes. So one known established cause is what we call a molar pregnancy. So molar pregnancy is, in layman language, I would define it as, just imagine a state where a woman sleeps with a man, and it happens to be at that time of the month where a woman is supposed to release an egg, what we call ovulation. So you sleep with a woman at the time where she's not safe at all. She has the egg around. But the unfortunate part is the egg that is being released is empty. Just imagine an egg of a chicken where there is no yolk on the inside. So that can also happen in humans. So you produce an egg, but it's empty. And then the sperm comes, it meets that beautiful egg that is empty on the inside. It enters, looking inside, looking for the yolk. It can't see anything. So what happens is that sperm is going to divide itself into two, and is going to pretend that as if it is the one that has brought the yolk into the egg. So you will conceive something that may look like a pregnancy, but in actual sense, it's not a pregnancy. So it's what they call a molar pregnancy. Or sometimes it can happen when two sperms are very greedy. They enter one egg at the same time. So when they enter one egg, the egg fidgets and gets onto one, but then the other one is stuck on the inside, so it can't do anything. So it deceives to that other sperm that there is a nucleus, there is the yolk on the inside. So you get a pregnancy where half is human, half is not human. So that's what we call a molar pregnancy. So in that state of a molar pregnancy, it produces high levels of that hormone called HCG that makes you extremely nauseous and you start throwing up. So that is the only plausible cause that we have for hyperemesis gravidarum. But other than that, it's largely unknown why some women really go up and throw up excessively and they lose weight. Yeah.
So for that, I'm interested in the molar pregnancy, and I'm sure someone out there will be interested in that. So for such a lady, what next? Like, what happens? Like, what do we do with the molar guy? Like, what happens? What next?
So the unfortunate part is you can never keep a molar pregnancy. Yeah, because first of all, it grows at a very fast rate. You find someone is 3 months pregnant, but the tummy size is this. It's huge. You may think someone is like 6 months. So that's one of the signs you can look out for. Then two, they tend to bleed a lot.
Okay.
So you find
during the pregnancy.
Yes. So you find someone is like 2 months, they're already bleeding, they're using pads. So that's another sign you have to look out for. Then the other sign that can be very plausible to look at is the excessive vomiting, nausea and vomiting. Now, once you have any of the signs that I've mentioned, and you go to, say, a gynecologist, and you're worried about your pregnancy, they do a scan. There's some things we look out for in the scan that guide us to let us know that someone has a molar pregnancy. So once we find that, the only solution we have is to extract everything, because it's not human at all. It's not human. So we have to take it out. Unfortunately, we have to take out whatever is growing inside your womb. So afterwards, we have to monitor you over time, because sometimes they can progress into a cancer. That's the unfortunate part. But everything is manageable. So just make sure when you're pregnant, you attend antenatal care. If you don't attend antenatal care, you'll never find out of all those things. You find someone is struggling deep in the village, they have a molar pregnancy, and they're carrying it, they're struggling with it, but it can never yield anything. Not every positive urine HCG test you do implies that you're actually pregnant. So always, when you test positive, when you have a pregnancy test that is positive, at any given chance, please start antenatal care, because that's the only way you'll find out whether whatever you're carrying is normal or it's abnormal.
Or it's abnormal.
Yeah.
So when if I get a positive HCG and it's like 3 weeks, when do I start antenatal? There and then, or is there a specific timing? Like I should wait for 1 month? Or...
So antenatal care usually, the moment you find out that you're pregnant, the moment you do a pregnancy test and it turns out positive, try to start thinking about antenatal care. Start thinking about the journey of you being a pregnant woman to the point that you deliver. So for people, as we know in Africa, most of us were conceived unintentionally. Yeah? And it's just been known that most pregnancies conceived in Africa are not planned. There's actually a very beautiful study that was done in 2013 that revealed that that year, over 4 million pregnancies were conceived in the whole year. And only 1.2 million pregnancies were actually planned. So you find that the largest proportion was never planned. So our parents were just there, and then before they knew it, the mother's not seeing her periods, and you'd be like, you know what, mommy, husband, I think I'm pregnant. So as we accept and embrace that happens at all times, so it means we do not do proper preconception care. If we plan our pregnancies properly, you would take some supplements, or you will switch to a particular diet that will make it more convenient for a baby to come in the situation. But if you didn't have any preconception care and you find that you're pregnant, then it means you have to supplement your body with some relevant supplements. Your diet has to be modified. First-time mothers, they need a lot of information on the do's and don'ts. If you have some medication you've been taking and it may not be actually appropriate, or it may be harmful to the baby, so you need to start having those conversations with the doctor. I actually advise, if you find out that you're pregnant, please go and meet a doctor and start discussing about the journey of you being a mother, because as I mentioned, lots of things have to be put in consideration. You may be taking some medication. What if you're epileptic? What if you're asthmatic and whatever you're taking is not good for the baby or can make the pregnancy come out? What if you're at that point you're having a particular infection and you're taking some antibiotics which may be harmful to the baby? So you need to evaluate a lot of things in your life. You need to learn about pregnancy itself so that you can have a very beautiful pregnancy journey. You need to know about some of the foods to eat, because there's a lot of information on the internet. Some is correct, some is wrong. Now that we have TikTok, everyone on TikTok is...
TikTok doctors.
Everyone is a TikTok doctor somewhere. So you need to get proper information from a health worker, and that can only be achieved if you attend antenatal care at your earliest.
So let's go back to the hyperemesis gravidarum. So we had stopped at a point where the mother now suspects they have hyperemesis gravidarum. What next? Still, like, should they go? Of course, they should go to the hospital. Can they be helped?
Yeah, actually, there is a lot of help in hospitals. So once we identify that someone has hyperemesis gravidarum, first of all, we start with patient education. We need to teach you. We need to teach you whatever is happening to your body. That is very important. If you understand whatever is happening to your body, it's easy for you to embrace, accept, and get the necessary help. That's point number one. Point number two, we need to look at rehydrating your body, because you're losing all these fluids. You've been throwing up I don't know how long, because in Africa we tend to come to hospitals when things are extreme, things are out of hand. If you identify it, maybe you come to hospital after 2 weeks of you being suffering at home, so it means you have lost a lot of water. So we have to replace that water that you've lost. So we have to admit you, depending on the state you come in, the severity of your condition. We look at your blood pressure, we look at your pulse rate, then we stabilize you. After stabilizing you, we have to encourage you to take plenty of water during the day. We have to tell you to take small bits of food. We have to teach you about the natural remedies, things like ginger. And once we've instilled that education in you, we have to be on your speed dial. In case you're throwing up excessively 2 consecutive days, or one beautiful day and then you throw up, and then at the end of the day you're weak, you're subconscious, you have to return to the hospital as early as possible, because hyperemesis gravidarum, it's a terrible condition. You can actually end up costing you your life or even the life of the baby. So you have to always be cautious. Always have doctors on your speed dial. Have a medical center or a hospital that is a bit easy to access to get the necessary help.
Okay. Thank you very much, Dr. Blair. This has been a very meaningful conversation. So as we have come to the end, I am requesting you to tell our viewers, someone out there would want to maybe reach out to you. How can they get you? Or you could tell us about Usawa, as we close.
So thank you so much. It's been a very beautiful conversation. So for those who would like to get in touch with me, I'm always available on social media. So if you go on Twitter, you'll see Blair Kizza, Dr. Blair Kizza. You go on Instagram, same thing, Dr. Blair Kizza. My business, back then I used to do online consultations. The number is still available. It's 0773 54 41 53. So if you want to get in touch with me, you can WhatsApp me on that number. And also, just to tell you about Usawa Health Initiative Uganda. It's a community-based organization. We have our offices in Kalere. And basically what we do is we harness access of healthcare services to people. So if you're a person who's struggling deep down, you're struggling to get access, especially sexual and reproductive health services, things like family planning, things like antenatal care, things like fistulas, and things that have to do with reproductive health. Usawa Health Initiative Uganda is there for you. So thank you so much for having me today.
Thank you so much for coming. I'm sure you guys have learned so much. I'm sure even if you're not pregnant, even if you're not a lady, you have someone around you who's pregnant. You have someone who you could help with this information. So I hope that you have learned a lot. Basically, for me, my take home probably is morning sickness is normal. If you see that your morning sickness is beyond normal, you're vomiting more than 4 times a day, it's literally taking a toll on your life, you're losing weight, please reach out to the nearest doctor and you will get help. So this is My Doctor podcast. Thank you for tuning in. My name is Mwesigwa Joy and I am your host. Thank you.
My Doctor, your health anytime, anywhere.